Hello and welcome. I'm Dr. Tracy McClellan with the Medical Institute of South Georgia. Welcome to Nurse Aide Training. We are covering Chapter 5 from our Nurse Aide Training book. You should have a textbook that looks similar to this. And a little closer. There we go. Is that better? Yeah, I think it is somewhat. All right. The Nursing Assistant by Hartman. All right, Chapter 5. Let's see where we are. Chapter 5 is confusion, dementia, and Alzheimer's disease. All of us, at some point in time, have been affected with a loved one who may be experiencing dementia. It may develop into full-blown Alzheimer's disease. So let's talk about how do we care with our heart for these folks who may be experiencing dementia or some Alzheimer's. So hello again, I'm Dr. McClellan. And this chapter is one of the most important because you'll meet many residents living with memory loss, confusion, and changes in behavior. Understanding how to respond with patience and compassion will make all the difference in their quality of life and in your success as a nurse aide. So let's start out with section 1. Remember again, for each chapter, you should be also working in your workbook as you're reading the chapter. Most of the chapters, you're going to need to read them a minimum of twice to get all of the detailed information that they're offering to you. Some chapters, you may have to read sections more than twice, to really grasp the information and make it stick, okay? I love the word called repetition. Repetition is good because it allows the brain to grasp that information. The more times it see it and hear it, the better you're able to learn that information. So let's start out with section 1, understanding confusion and dementia. Let's begin by defining a few key terms. First of all, let's look suddenly or gradually. Causes may include infection. Yeah, an infection can cause a person not to be able to think clearly. It may be low blood sugar. It could be dehydration, medication reactions, or simply being in an unfamiliar environment. Another term you should be familiar with is dementia. Dementia is a more serious, long-term loss of mental stability, such as the ability to think, to remember, and reasoning. It's not a normal part of aging because you may have a 74-year-old person over here who is having full-blown dementia, can't remember where they put anything, don't remember what day it is, and you have another 74-year-old over here who's working part-time at the local Walmart, or who may be working at the local library, putting books back on the bookshelf. So it doesn't necessarily say there's a particular age time frame that this would occur, and every elderly person does not lose their memory. So you want to make sure you keep that in mind. So it's not a normal part of aging, though aging increases its risk. Alzheimer's disease is the most common type of dementia. You need to know that. It's a progressive, irreversible disease that affects the brain and slowly destroys memory and thinking skills. As caregivers, it's our job to focus not on what residents have lost, but on what they can still do. So keep that in mind. It's not doom and gloom. We want to redirect them to things that they can do. Now, section 2, common causes and symptoms that we see with memory loss. So there are over 100 different causes of dementia. Alzheimer's, vascular dementia, and Lewy body dementia are among the most common. Symptoms often begin with mild forgetfulness, misplacing items, or forgetting recent events. As the disease progresses, residents may repeat questions, forget names, or become easily frustrated or afraid. Understanding that these behaviors are symptoms, not choices, will help you respond calmly and with empathy to the patients you're caring for. Section 3, the stages of Alzheimer's disease. It's important to be familiar with that. Alzheimer's progresses through several stages. Early stage. With early stage Alzheimer's, the resident may still function independently, but begin to forget familiar words or recent events. With middle stage Alzheimer's, confusion increases. The person may wander, have trouble recognizing family members, or even struggle with the day-to-day activities. In the last or latent stage of Alzheimer's, the resident may lose their ability to communicate, to eat, or move without assistance because their brain is not connecting. The nerves to their brain does not connect to say, you need to move your arm, so they can't move their arm. You need to get out of bed, so they can't get out of bed. It's important to meet residents where they are, not where we wish they were. It's you want to always focus on maintaining comfort, dignity, and safety at each stage. Section 4 is communication techniques. Here are some things that you can do to help you with communicating with our elderly who may be experiencing dementia and Alzheimer's. Communication can be one of your biggest challenges, but also one of your greatest rewards. When speaking to a resident with dementia, approach them from the front. Smile and make eye contact. Use their name and introduce yourself every single time. Speak slowly, calmly, and use short, simple sentences when you're communicating with them. Avoid arguing or correcting. Instead, redirect or reassure. For example, if a resident says, I need to go home, you might say, tell me about your home, rather than, you live here now. Validation and redirection work far better than confrontation. All right, section 5, managing difficult behaviors. Residents with dementia may experience mood swings, anxiety, or aggression. Some of them, yes, will curse you out, okay? Just giving you the real. Often these behaviors are ways of communicating discomfort. Maybe they're cold, maybe they're hungry, in pain, or frightened. So always watch, you as a nurse aide, always watch out for those triggers, loud noises, cluttered spaces, or too many people talking at once. Stay calm, use a gentle voice, and give the resident space. Always ensure safety first, because at this level in their life, that's what they're concerned about. Am I safe? Yours and theirs, and report all behavioral changes to the nurse immediately. Remember, your calm presence helps them feel safe when their world feels confusing. Now, for section 6, promoting dignity and independence. Even with memory loss, every person deserves to feel valued. Include residents in simple choices, what to wear, which meal they like, or what music to listen to. Maintain routines, you want to make sure you speak to them respectfully. Avoid talking about residents as if they are not present. Encourage activities every day, things that they enjoy doing, folding towels, watering plants, or even listening to their favorite music. All of this helps to preserve their sense of purpose and comfort. Section 7, your responsibilities as the nurse aide and family support. Families often struggle emotionally when their loved ones develop dementia. So be patient with them. They're still trying to adjust, that mom doesn't know who they are, that they are trying to have conversations with mom about things that they shared together, and mom has no recollection. She cannot remember the things that the family member is saying. And so it can be frustrating for them as well. So often reassure, keep them informed about the changes that are occurring with their family member, and treat the family members as a part of the care team. As a CNA, a nurse aide, the role includes observing changes, preventing injury, maintaining hygiene, assisting with nutrition, and providing emotional comfort to both the patient and the family members. Each moment of kindness, a smile, a touch, a calm word can ease fear and confusion. In closing, for Chapter 5, caring for someone with dementia is both challenging and sacred work. You may not always be remembered, but your kindness will always be felt. Remember, patience is power. When you remain calm and compassionate, you bring peace into a resident's world of uncertainty. Make sure you review your Alzheimer's care tips in Chapter 5 and remind yourself why you chose this path: to make a difference for one resident at a time. That's Chapter 5. In Chapter 6, we're going to move into personal care skills. Here's where you get your hands dirty. The hands-on work of daily caregiving done with safety, skill, and dignity. I'll see you next time.